Today, Doctor. Today, Group 16 is honored to present on the MRI scanner and its application in medical diagnosis. My name is Ling Ming Singh, and my metric number is 24006135. The MRI scanner is a crucial non-invasive tool used in diagnosing various conditions across multiple bodily systems. It provides detailed imaging of the neurological, musculoskeletal, cardiovascular, abdominal, and pelvic, vascular, and endocrine system. To understand its importance, let's first look at the primary functions of this system. Neurological system control body coordination and responses, including the brain, spinal cord, and nerves. Musculoskeletal system responsible for movement and posture, involving bones, muscles, joints, and tendons. Cardiovascular system circulates blood, oxygen, and nutrients throughout the body. Abdominal and pelvic system facilitates digestion, reproduction, and metabolic processes. Vascular system is a network of blood vessels distributing oxygen and nutrients. Endocrine system regulates hormones that control metabolism, growth, and reproduction. Despite its diagnostic power, challenges remain in treating and restoring function in this system. For example, in neurological, stroke, and neurodegenerative disease, present rehabilitation challenges. In muscular system, severe injuries and joint disorders can cause long-term disability. In cardiovascular system, conditions like heart failure and coronary artery disease are difficult to fully treat. Abdominal and pelvic system disorders such as cancer require early detection for better management. Vascular conditions like aneurysm and blockage need continuous care. Endocrine hormonal imbalance such as in diabetes are primarily managed rather than cured. This is a quiz that you can try if you are interested. That's all for me, and I will pass the presentation to my partner. Thank you.
My name is Tan Chen Yang, and now I will introduce the functionality and suitability of MRI scanner. The main function of MRI scanner is to produce three-dimensional detailed anatomical images of body organ. There are three important components for the MRI scanner to generate the 3D image, which are strong magnetic field gradient, and also radio wave. Now I would like to briefly explain how MRI scanner carry out its function. First of all, when a patient is placed into an MRI scanner, the strong magnetic field produced will cause the proton in the body, such as hydrogen nuclei, to align their axis of rotation with the field. Next, a radio wave is then released to stimulate the protons to spin out of their equilibrium. After the radio wave is turned off, the protons will realign back with the magnetic field and release radio frequency signals. Those signals is received by a computer and is converted into a MR image. MRI scanner is suitable for imaging of non-bony parts or soft tissue in the body. Due to the MR image produced by MRI scanner consists of high contrast of soft tissue, MRI scanner is used as a preferred medical examination tool in real life. It is used to identify disease at early stage, distinguish active and stable condition, and also monitor evolution of disease and reaction of treatment in patients. For neurological system, MRI scanner function to examine brain-like structure and also identify brain tumor. MR image produced able to tell the location and size of brain tumor. For cardiovascular system, MRI scanner provide clear image of vascular anatomy and also real-time imaging of beating heart. Thus, is able to diagnose myocardial disease and atherosclerotic plaque imaging. For musculoskeletal system, MRI scanner usually used to identify those problems related, such as knee joint problem, but is not suitable for imaging of subtle bone avulsion. And the last part is abdominal and pelvic system. MRI scanner is very important and suitable for diagnosis of abdominal pelvic pain in pregnant patient. Since it does not emit ionizing radiation, it is considered safe to pregnant patient and also the fetus in the body. Based on the research, it's proven that MRI scanner with 1.5 Tesla will not cause negative effect to hearing function at birth weight percentile of newborns.
I will introduce the addressing current limitation. So first, we should identify the medical needs. So as we all know, MRI has become one of the most important biomedical devices for disease diagnosis. So first, it is a key tool for disease diagnosis. It can efficiently study the anatomy, metabolic activity profusion, functional states, molecular properties of various tissues and organs without the need of invasive procedures or radiation. The second one is critical for pre- and post-treatment assessment. It can help doctor formulate and plan surgical plans and paths. And some special types of MRI, such as functional MRI, can also help to avoid injury to critical areas during the surgery and in improving the operation efficiency and safety. Then the innovation impact. So first is the transformation of medical diagnostics. So MRI has dramatically improved the way for disease diagnosis and evaluated through its high resolution and radiation-free. And functional imaging, also called DWI, has advantages in recognizing renal cell carcinoma from benign kidney tumors. And the second one is the advancing medical research. So MRI has played a driven role in research in areas such as brain science, cardiology, and oncology. For example, the ultra-fast ultrasound imaging technology in recent years has improved the detection capabilities of low speed and weak blood flow. It brings a new type of technology such as functional ultrasound imaging, and also well known as the FUSI. And as the development of the technology, the new type of MRI are constantly updated.
Let me introduce some limitations of MRI scanner. The first one is long examination. MRI scans require longer durations compared to X-ray or CT scans, causing patient discomfort, especially in narrow tube devices. And the sedatives may be necessary for children, elderly patients, or those with neurologic conditions, increase costs and risks. Longer scanning time limits patients through output and may delay treatment progress. And the gradual improvements are enhancing patient experience and procedure efficiency. The second one is weight and size restriction. Conventional MRI machines typically accommodate a panel of 60 to 70 centimeter in diameter and a weight limit of 200 to 250 kilogram. Challenges arise for obese or heavy patients, make some scans unfeasible. Advancements are addressing this issue, offering great inclusivity and efficiency. The third one is not suitable for certain implants. Strong magnetic fields can interfere with implants like pacemakers and so on. Risks include organ injury, device malfunction, or heat effects, necessitating alternative imaging methods. Despite MR's diagnostic superiority for soft tissue, implant incompatibility remains a significant constraint. The last one is high cost. Expensive equipment and infrastructure increase cost. Maintenance and operational expenses limit accessibility, especially in low-income regions. Economic challenges affect healthcare equity, the technological and policy.
My name is Nurul Atenia, and I will introduce you the improvement of MRI scanner. The first one is implementation of artificial intelligence. This is used to accelerate the evaluating process of MRI scanner. So how? AI will reconstructing the undersample MRI data, and AI also generating high-resolution image from low-resolution data. And the last one, AI also use the approaches deep learning method and variational network to accelerate the evaluating process of MRI scanner. So the second one is larger bore size. This is to ensure patient could feel more comfortable during the process. So larger space are thought to be beneficial for claustrophobic, anxious, and larger patient, and lower noise level. Larger bore size with development of low field MRI, which is 0.55 Tesla scanner, allow to lower the noise level. So the third one is PTI system implementation. This is to ensure patient with implant can go through MRI scanner safely. This system is used to reduce the specific absorption rate, which is SAR, the rate at which energy is absorbed by the human body when exposed to an electromagnetic field. So PTI system is a practical way to address the growing complexity and the quantity of medical implants in MRI patient. So by using a channel, PTI coil suppresses undesired hotspot caused by DBS leads better than a 4-channel PTS coil. The last one is low-cost MRI scanner. This is used to increase the accessibility and expanding the uses of this MRI scanner device. The first one is to create a minimal cost redesign with a trade-off between these three parameters, which is magnet pore diameter, the magnet length, and the diameter of the homogeneous spherical volume. The second one is using permanent magnet designed for low-field MRI system. And the last one is the image encoding system are applied to reduce the cost of the device. To conclude, MRI scanner provide high-resolution, non-invasive imaging with excellent soft tissue control, essential for diagnosing neurological, cardiac, and musculoskeletal conditions. With recent advancement, including AI integration, low-field system, and cost reduction strategies, enhance the accuracy, accessibility, and patient comfort.